Once you know you are going to have hip replacement surgery, it is essential that you get your body active. The fitter you are before your operation, the faster you will recover and be able to return to normal activities afterwards. There are many factors that you must take into account before your operation. Here are some key pointers that will aid your recovery.
Before your surgery, it's important to keep as fit as possible by regular exercise. I'd certainly recommend a daily walk, or if you find this painful, you may find swimming easier. It's most important that you keep your muscles strong. This will speed your recovery. It's so important that I'd exercise, even if it is a bit painful. There's no harm at all in taking painkillers in this event. There are two simple ways to improve your health prior to surgery. Firstly, take as much exercise as you can. Secondly, if you are overweight, you really should make an effort to lose some. Complications following hip surgery are seen much more frequently in patients who are overweight. By losing weight, you'll reduce these risks and probably your hip replacement will last rather longer. If you're getting pain from your hip whilst you're waiting for your surgery, don't be afraid to take painkillers. You may find that paracetamol is sufficient, but if your pain is greater than this, you may have to visit your general practitioner to get a prescription for some stronger painkillers. Pain relief from your arthritic hip will be reduced if you lessen the load going through the joint. To do this, you can use a crutch or a stick. Remember, it's important to use your walking aid in the opposite arm. So if you've got a painful right hip, use your stick in the left hand and vice versa.
Do remember, it is very important not to ignore the little things.
It is crucial to look after your feet prior to your hip replacement. Ingrowing toenails or callosities can be a source of infection that could spread to your hip. It's therefore most important that you tell your surgeon about any problems with your feet so that these can be sorted out prior to your operation. Cuts or abrasions can get infected. This infection could spread to your hip. Therefore, any active infection might well lead to postponement of your operation. I would therefore suggest that if you develop an infection, you consult your surgeon or general practitioner who might well decide to give you a course of antibiotics. Loose teeth or dental abscesses can be a source of chronic infection that could spread to your hip replacement. If you have any problem with your teeth, it's very important that you consult your dentist prior to your hip operation.
Before your operation, you will attend both the hip school and a pre-assessment clinic. They will go over all the healthcare guidelines you have just seen in more detail and give you the opportunity to get involved in preparing for your hip replacement. Remember, it's important to keep active before your surgery, as it will make the operation and your recovery run smoothly.